Bronchitis. Normal physiology of the respiratory tract. Air is inhaled through the nose and mouth and then passes through the pharynx, larynx, and epiglottis. The air then continues down the trachea, which divides into two bronchi, the left and the right. The air then travels through smaller bronchi and bronchioles. The bronchi are divided into three subdivisions, the main, lobar, and segmental sections. The air then travels into the alveoli, where gas exchange of oxygen and carbon dioxide occurs. In normal gas exchange, the partial pressure of oxygen in the alveoli is 104 millimeters of mercury, and the carbon dioxide is 40 millimeters of mercury. This is when sufficient amounts of carbon dioxide is being exhaled and oxygen is being inhaled. The trachea is lined with cilia to collect dust, and the smaller bronchi have fewer goblet cells and cilia. Therefore, they need macrophages in the tissues for protection. The definition of bronchitis is inflammation of the mucous membranes of the bronchial tubes in the lungs.
Bronchitis can be found in its acute or chronic form. Acute bronchitis is a common illness that causes an infection in the upper respiratory tract. The infection causes a cough that lasts more than 5 to 10 days. It is usually caused by a virus or a cold and flu. Chronic bronchitis is distinguished by having a chronic cough for 3 months of the last 2 years, and if continues, develops into COPD, chronic obstructive pulmonary disease. Several irritants, such as cold and flu viruses, air pollution and environmental factors, dust, toxic gases, smoking, can cause bronchitis. These irritants cause the mucous membranes of the bronchi to swell and secrete excess mucus in an attempt to remove the irritants. Normally, the number of goblet mucus-secreting cells cover less than 40% of the area of the lining of the bronchial tubes, but prolonged irritation can cause the goblet cells to proliferate, which increases the area in which the goblet cells cover to over 50%. Because of the excessive mucus production and chronic swelling, the cilia become damaged and mucus cannot be removed efficiently. It then becomes fibrous and obstructs the airway, impairing ventilation. Because of this, infection often occurs in the bronchioles because of the mucus pooling and being thriving environment for bacteria.
Few symptoms of bronchitis are wheezing, decreased exercise tolerance, hacking, chest or shoulder pain, production of mucus, which can be clear, white, yellow, or green in color. Chronic bronchitis can cause respiratory acidosis. Respiratory acidosis is a condition that occurs when the lungs cannot remove all of the carbon dioxide the body produces and cannot get enough oxygen into the lungs. This leads to a high concentration of hydrogen ions, decreasing the pH in the blood and body fluids, making it acidic. Bronchitis also leads to the production of more goblet cells in the lower airways and overproduction of mucus. This mucus becomes so thick that it makes the cilia ineffective. This makes the lungs much more prone to infections like pneumonia. The inflammatory pathway is also triggered because of irritants in the lungs.
Proteins. As bronchitis progresses, the elastic fibers, which are made up of proteins and surround the bronchioles, become fibrous and stiff, which makes it difficult for the bronchioles to expand and contract while breathing. When an infection is present, our body stimulates acute phase proteins in the liver and blood. When these proteins are activated, they promote the production of pro-inflammatory proteins such as cytokines. The irritants in the lung stimulate the epithelial cells of the lung to release neutrophils and chemotactic factors, also part of the inflammatory pathway, such as interleukin-8. Neutrophils secrete proteins which cause damage to the lungs as well as hypersecretion. Cell membranes. The cell walls of the bronchial cells that are exposed to irritants become more permeable. This causes the swelling and fluid to move from the ECF to the ICF.
In summary, chronic bronchitis is a form of chronic obstructive pulmonary disease that causes the overproduction of mucus in the lower airways and also hardens the elastic fibers surrounding the bronchial tubes, which in turn makes it more difficult for the bronchial tubes to expand and contract. The excess mucus becomes viscous and is unable to be cleared from the lungs. These pools of mucus become breeding grounds for bacteria, causing pneumonia and other respiratory infections. Bronchitis causes there to be a higher concentration of carbon dioxide in the lungs. This causes an imbalance in the oxygen levels in the blood, and also leads to respiratory acidosis because of excess hydrogen ions.